Well, it's 10 a.m., so we will go ahead and start our Health and Hospital Committee meeting for December 12th, 2018. Supervisor Simidian is out of the country, and so he will not be joining us today. We'll be holding this meeting as a workshop. We won't be able to take formal action on any item. We don't have a consent calendar. However, for items 9, 10, and 11, I don't need a presentation and I don't have any questions on those items, so we can go ahead and forward those items to the full board. And I'd like to hold item number 5 to the January Health and Hospital Committee meeting. That way the new committee can hear that report and make decisions about whether they need any additional reports in the future on the 2008 Measure 8 program. So with that, we do public comment, and we have 2 speakers under public comment, Leonard Williams and Bob Jasinski. So gentlemen, if you want to come on up. Oh, all right.
Good morning. My name is Leonard Williams. I'm here on behalf of my PFAT group. I'm the ambassador for Valley Medical and its clinics. I'm here to thank Ken Yeager for all the service he has given us over the years. He's been stout heart. He's been willing to help us out. And you know, in these times and ages when people say, well, you know, people can't afford this, we don't care about the poor people, the people that can't afford medicine. All of you folks have been there, but Ken was in my district, and I've known Ken for years. I worked when his campaign was for city council one time. I can't find a better person to work with it. So I would love to thank Ken and wish him the best. I wish he was staying for forever, because he, to me, is Mr. Health. He's always been there. He's always given us the cooperation and the support we need. So Ken, thank you for all you've done over the years, and I look forward to seeing you in the future.
Thank you, Leonard.
My name is Bob Kaczynski, and I'm going to take off my PFAT badge for a minute and speak on behalf of the resident of Santa Clara County and also patient at Valley Medical. I'm here to personally thank Supervisor Ken Yeager for all his work he's done in our healthcare system in this county and with the hospital. His tireless work on advancing great healthcare in this county. #1 hospital in the county, in the state, and in the country, thanks to his leadership and stuff. So I want to personally thank you, Supervisor Yeager. You are going to be really missed. You are Mr. Healthcare for our county, and I thank you for that. Now, I'm going to put my PFAT badge on, and I'm going to talk about PFAT for a minute. I want to thank all of you for your support with PFAT and the county administratives to supporting the supervisors that support PFAT. It is a great organization. I thank you. We have a great team at East Valley. We had our annual meeting just recently, and the room was full of PFAT members and staff. I've never seen this. We are growing, and I appreciate that you folks listen to us and take our inputs. That's what makes this a great hospital. I have friends in Southern California I talk about all the time. I said, do you guys do this? No. Do you do? I said, we do. We do. That's why I say, that's why we have the greatest hospital around, because they take patients' input and that helps out the patients and the guests that use our facility. So I want to thank you. I'll tell you one little other story. I'm 72 years old. At my age, you're not acquiring new friends. Your friends are dying off. I had lost 2 relatives this year and 3 close friends. But with PFAT, being a PFAT member, Leonard and I became close friends. So at my age, I'm acquiring friends, which I didn't have before with PFAT. He's my buddy. He's my friend. We're joined at the hip, and we get together every so often and have lunch at the hospital, the cafeteria. It's a great place to eat. I recommend it, okay? And it's affordable. And we just talk about things. And that's because of PFAT that happened. So I appreciate and thank you for your support. Let's get up and thank all of you. Get up, get up, get up, get up, get up, get up. Thank you.
Thank you very much. Scott, as you're coming up, I know that we have 2 speakers from the Healthier Kids Foundation, one for item number 2, which is the public comment, and another one for 3, which probably might be related to the behavioral health item. I just didn't know if you wanted to both be under that item or under public comment. This is Denise and Sunny. Under 2? All right, so if you want to then come up as well. Scott?
Okay, thank you, everybody. Scott Largent. Running a little behind. I took the light rail today. I'm having a little bit of problems with the new car, so I have a visit today with my daughter. So I had all the toys, and when I got out of that light rail, I absolutely ate crap and fell down, and all her toys went everywhere. I had to dust off Captain America. This is absolutely, she adores Captain America. She gets so excited about that one. Same with her Minnie Mouse. That's a must. I get in a lot of trouble when I don't bring that one. And then what I've started doing is I find all these little hand puppets, and she loves these. I mean, I've got piles and piles of them in here. I think the little giraffe's in here, too. And then her favorite one of all, okay, is her little mini megaphone, okay? And Dad didn't first introduce her to one of these. McDonald's did in a Happy Meal, of all things. So when she opens up the Happy Meal and she sees it right away, she goes, "Daddy, Daddy!" You know, she gets super jazzed about it. So I got her one with the actual battery in it. And this thing's helpful because she's going to have to learn how to stand up for her rights and fight for her father, because none of you are doing that right now. I had a court appearance in front of Judge Helen Williams. And that's another one, just like Manukian, Judge Stewart, Towery. I cannot use this device now within 300 feet of the San Jose Police Department, okay? Now remember, it's not a criminal thing they're doing. This is a civil lawsuit against me. So they'll put in all these regulations and rules for Scott to abide by, but they'll probably drag this lawsuit out for probably 5 years. Now remember, I begged and pleaded the IDO to appoint me counsel. Sylvia Perez's advice was to ask the judge, when I went in front of her, if she could assign counsel to the IDO. So first off, she denied that right away out the gates, okay? Then what I wanted to do was get a continuance. I said, hey, I've got to get my ducks in order. You know, I'm fighting for my First Amendment rights. I need more time. They slapped this right in front of me right before I was going out of town on Thanksgiving. So then what I thought, you know what? I need legal advice. I don't know what I'm doing. I absolutely don't know what I'm doing. So I tried to recuse the judge. And it was a 170.1, I tried a 170.3, and I tried a 170.6, okay? She said it wasn't timely because the proceeding started and I was asking for a continuance and also to have counsel appointed. So you're all seeing how this is rigged right now. I wasn't able to do anything. Not only, and there's another problem too, there's a conflict of interest. She gets her marching orders from our presiding judge, Patricia Lucas, that also had me arrested for protesting, and those charges are pending right now. So you kind of see she gets her marching orders from the same person that had me arrested. So that's unacceptable too, and she also ruled against my appeal with the original Bullhorn conviction that I fought. So it's a scam, and I'm still fighting, but this is shameful. Thank you.
Thank you. So Sonny Ochoa and Denise Alvarez, and then I have a card from Natalie, but there's no item number on it. Natalie, where might you be? Well, seem to have lost Natalie. All right.
I think that's her.
Oh, I'm sorry. Are you here for item for 3B? All right, thank you. That's all I needed to know. Good morning.
Good morning. Thank you. My name is Sunny Ochoa, and I'm here from Healthier Kids Foundation. And we also wanted to take a few minutes to thank Supervisor Yeager for all of the work and support that he has given to us over the years. Without your vision, without your support, we would not have been able to do the work that we've done. To date, we have provided over 200,000 screenings to kids in Santa Clara County. With that, we have gotten over 7,000 kids to see an optometrist by using their health insurance. Of those kids, Ken, we've put 6,000 kids in glasses, and that was something that you were standing by our side and supporting us through. We have, as of last year, well, actually, as of the beginning of this week, we had screened 53,000 kids in Santa Clara County for dental issues, and almost 8,000 of those kids have gone in to see their dentist. In this county, we have a 31% urgent to emergency need for dental issues. That means that kids are having severe to moderate cavities. Denise is going to talk about one of those families in a bit. We've also put 1,300 kids into a hearing specialist because of your support for Healthier Kids Foundation. Also, last year, you're one of our champions that really saw the benefit of giving 10 steps to a healthier you to child care home providers. Last year, we had 130 providers attend our classes. With that, we have gotten phenomenal feedback. We have one woman in particular who reported back this last year that she and her house are living the 10 steps. They have eliminated all soda. They have eliminated fruit juice in her home. And yes, we're not a weight loss program, but she reported back that she lost 25 pounds in the process. And through 10 steps, we asked that provider, what you're doing for your kids in your classroom setting, we want you to model in your home. And the providers are doing that. They're offering water every day to their children. We give out these great pictures that are now set out, and the kids can serve their own water. We're also getting feedback where providers are saying, no more juice. We had a provider say, oh, well, I give orange Fanta to my kids because it's orange, right? And so we really had to explain that that's a soda. It's full of sugar. Through the 10 steps, we read the back of the packages. We talk about how much sugar is in that. We also talk about how that affects a child's teeth. And so we're having providers say, no more fruit juice. They're offering fruits instead, apples, oranges, bananas, grapes. And that's where the kids are getting their sweets from. We just, again, wanted to take this opportunity, Ken, to really thank you for all of your support and your vision, because without you and without your support, we couldn't have done all of this work we've done today. Thank you.
Thank you.
Hello, good morning. My name is Denise Olivares, and I am here as a case manager with the Healthier Kids Foundation. I'm also here to thank you, Ken Yeager, on behalf of the families that we help, we support, and that we case manage. I'm here to share a wonderful story of a little girl who's 12 years old, whose vice principal contacted our agency because this little girl was being bullied, and she was having a lot of suicidal thoughts because of the bullying and because of what she was going through at school. She was born with a syndrome that didn't allow her to grow any upper or lower teeth. So sadly and unfortunately, she looked different than her peers. So she was being made fun of at school. Thanks to her vice principal that was able to contact us, thanks to people like Ken Yeager, Healthier Kids Foundation, in collaboration with these schools, we were able to get this little girl a set of dentures. Literally, we have already heard from this vice principal telling us that this little girl's life has completely changed. She goes around campus smiling, she's proud, she's eager to learn, she's a lot more interactive and social with everybody at school. She's not that shy little girl anymore, and all just because she now has teeth. All the things that we may take for granted, a lot of these families unfortunately don't have access to. But thanks to people like Ken Yeager and the Healthier Kids Foundation, these families now have access to that. So I'm here on behalf of all these families that have been very blessed to be able to have these services, and that little girl who's now happily smiles at everybody that looks at her. Thank you. Just thank you.
Thank you very much. Dolores?
Good morning, Supervisor Yeager, Mr. Smith, Dr. Smith, and Mr. Santiago. I'm here to also thank Supervisor Yeager for his support and all the work that he's done over the last 12 years and beyond, and you'll continue, I know, in the area of healthcare. So very briefly, your support of the community health centers since certainly in my tenure has been incredible, wonderful. Very particular, your interest in quality improvement and the boost that we received from you, from Dr. Smith with Measure A a few years ago. The impact of that is long-standing, so I think that's kudos to both of you, especially to you, Mr. Yeager. Thank you. And your support and interest of the 2 clinics that have been in your district, also very, very much appreciated. And then from a personal perspective, I'll tell you what I've seen that's of value to not just the partnership, but to me as a person, is you're one of the many legislators in this county, but probably one of the very few in the state and in the country who take policy and follow it through. And I know I've said this to you before, but I think it's worth repeating. So it's initiating the policy, continuing to check with the stakeholders, even asking for reports. And I think that's a very good model for the future. And then the other piece that's reminiscent of my time in public health as a manager, and then what I've tried to change in the community health partnership and the clinics with your help, is what we serve at our meetings. And we've gone from, I'm embarrassed to say, Kentucky Fried Chicken and Coca-Cola, seriously, many, many years ago, to what we served at our meeting we had with you the other day. So I'm glad it's in the contracts. That's a very important fact, because we need to walk the walk, talk the talk. We talk about diabetes, we talk our poor children, and then, So thank you so much. Look forward to continuing to work with you. Thanks.
Thank you, Dolores. All right, we're going to move on to item number 3, which is consider recommendations relating to the monthly report from the director of the Santa Clara Valley Health and Hospital System. Renee?
Yes, and good morning, Mr. Chair Yeager. And as we heard this morning already, this is a historic moment because as your last meeting presiding over our health and hospital system. And before I give my report, I think it'll be important for Dr. Smith to maybe get us in this track, because he was here long before any of us were up here in terms of the dais, and I think it'll be great for him to say a few words at the beginning.
Thank you, Renee. Well, today is going to be a love fest for Supervisor Yeager. The health and hospital members, leadership, and all of the 5,000 plus employees that work for health and hospital are going to celebrate today, not because you're leaving, but because of all the accomplishments you've had.
Both, I can understand.
All the accomplishments that you've had and helping them to provide services to our clients through the years. So I would just like to frame it that, for the 9 years that I've been here, it's been a pleasure working with you and having you committed to the public health and wellness of the entire community. It's been obvious that your dedication is to families and children and those in need and those who are ignored and who are denigrated for their status. And so I'm going to turn it over to Renee to fill out more, because I have a whole lot more to say tonight and I don't want to ruin it. So, but thank you, and thanks for everything you've done on this committee, because you've really helped to transform our health system to continue to be the fabulous system that it currently is, but to be ready for the near future and the far future when there will be new challenges and new goals. So thank you very much for being here. Without you, we would have been struggling. Renee.
And thank you, Dr. Smith. And I thought it was so important for people to say it in their own words. And I think for the general public to understand the significance of not only today, but the impact that you've had over the last 12 years is so important because you have presided over the health and hospital system really during a very historic moment in America. And I think we all know we had national health reform under and during your leadership. And despite the fact that there were a lot of challenges at the beginning in terms of a lot of doubts as to whether a health system was ready to take on the additional challenges of having to not only compete with the private sector, but then also improve our care delivery and service, we have done so successfully under your stewardship. And I think that's so important, not only obviously for you to feel good about your service to the residents in Santa Clara County, but then also for the general public to understand that what you did went beyond just this particular county. You represented us very well at the state. You represented us very well at the federal level, not only representing counties in California, but also health systems across the state and nationally, that your impact went beyond just the county of Santa Clara. Now, we do have several people that are here, some of them with surprises for you, because they wanted to be part of this moment. But before I turn it over to you, certainly on behalf of our executive leadership team, and certainly all the employees in our system, we're very deeply grateful for everything you've done for us, and certainly will continue to do for residents of Santa Clara County. Now, the first surprise we have for you is we have in the audience the President and CEO of the California Association of Public Hospitals, Erica Murray, wanted to be here and present you and say a few words on their behalf.
Thank you, Renee. Good morning. I'm here to congratulate and thank Supervisor Yeager for extraordinary leadership and support, not just of Santa Clara Valley Health and Hospital System, but of the 21 public healthcare systems across California. These systems, as you know well, form the core of the safety net. Supervisor Yeager joined the Board of Supervisors in 2006, just as we were beginning our first 1115 Medi-Cal waiver, the first of 3 major agreements with the federal government to support coverage expansion and delivery system transformation. Under the first waiver, the coverage initiative helped counties expand coverage to 230,000 low-income residents who weren't otherwise eligible for Medi-Cal. In 2010, we negotiated and implemented the second waiver, called the Bridge to Reform, which built on the coverage initiative with the Low-Income Health Program, or LIP, ensuring that more than 700,000 people were not only enrolled in coverage, but were assigned to a primary care medical home, so that when they became eligible for Medi-Cal in 2014 as a result of the Affordable Care Act, they were already getting the care they needed and in the most appropriate setting. Supervisor Yeager, you have consistently fought for and supported our efforts to secure these important agreements, knowing that Santa Clara would and did and continues to take a leadership role in performance-based programs. And we're now well underway, as you know, in our third waiver, which is the most ambitious and sweeping. To give you an idea of the impact of the programs that the waiver contains, as a result of Santa Clara's efforts in its current pay-for-performance program, PRIME, most adults in the county clinics receive systematic screening for depression, substance abuse, and interpersonal violence, again, getting the care that they need and in the most appropriate setting. Your local leadership of the Health and Hospital Committee, and importantly, your statewide leadership of the California State Association of Counties, or CSAC, their Health and Human Services Committee, has made a tremendous impact on improved care for literally millions of low-income and uninsured patients over the years. So thank you for your dedication to the public health care safety net. To recognize your contributions, we love tchotchkes, so we'll add one to your shelf or table. We present you with this token of our appreciation. It reads, "To Ken Yeager, with appreciation for his effective leadership in ensuring access to high-quality, equitable health care and promoting better health for all residents of Santa Clara County."
Thank you. Do you want to come on over and we'll take
a picture?
Pretty cool. Pretty cool.
And thank you, Erica, for being here. Now, my written report, quite frankly, documents for the historical record all the accomplishments in terms of the impact you've had here locally, but I think each department head will have, in their own words again, say how much gratitude, and we truly appreciate your leadership on behalf. So not unless you have any other further questions for me.
I say move on.
Pretty much done.
So then move on to 3B, which is to receive report from Working Partnership USA relating to the healthcare reform implementation public meetings. And I know we have several cards, but I'll call on the other people after you, Bob.
Had an excellent session last month on the subject of the status of Latino health and African American health in Santa Clara County. Ron Gonzalez, the CEO of the Hispanic Foundation of Silicon Valley, presented on the report card that his organization had done on the status of health care. The report grade was a D, primarily because of the incidence of obesity in the Latino community. Dr. Noah Alboleta and Alma Burrell from the Roots Clinic made a presentation on the challenges associated with providing empathetic health services to the African American community in Santa Clara County. And the county's own Lorena Madrid from the Public Health Department made an excellent presentation on the county's diabetes prevention programs, a way to respond to the problems that Mr. Gonzalez had mentioned, and hopefully those prevention programs will be continued. I would like to take this opportunity also to make a few comments regarding Supervisor Yeager, who I've known for decades. The phrase that best describes his service on this committee is above and beyond. Of course, in public service, like all other careers, we expect people to fulfill their basic responsibilities. But there are a precious few who consistently go above and beyond. They bring extra dedication and commitment. They bring additional effort and diligence. They show truly impressive courage, and they offer new insights and understanding. And as a result of these qualities, they generate achievements that are above and beyond. So on behalf of the stakeholders and advocates for health care in this county and for the people of the county who depend on county programs and county-funded programs for their well-being, I want to thank Ken for steadfastly being above and beyond for so many years. Thanks.
Thank you, Bob. We do have three speakers under 3B, Natalie, I believe it's Logan, and then Jackie Lopez. D is no, okay. We'll hold off on those then. We'll move on to C, which is to receive the verbal report relating to the federal health policy and budget landscape. Welcome, Bert.
Good morning. So, Mr. Chairman, we come to the end of 2018 with the two-year battle over ACA repeal and replace now behind us. The blue wave, Democratic control of the House, has ended the legislative threat, but we have other challenges that we have to contend with. The elimination of the penalty for the individual mandate and various administrative changes made by CMS has taken a toll. And the evidence for that is that as we approach the final week, or we're in the final week now, of open enrollment for 2019 for ACA, in the 39 states that rely upon the federal government to actually operate their exchange, enrollment is down by 400,000, about 13% drop from last year. It's not cataclysmic, it's not the end of the program, and it's possible that in the final week things will rebound, but the individual mandate penalty repeal, the elimination of navigators, all the administrative changes that have been made has had an effect, and we do have a challenge going forward to preserve and enhance the ACA, even though the threat of elimination is gone. The biggest threat, as we've discussed beforehand, goes beyond legislation, and the biggest threat we face in the coming months is the Texas versus Azar case, which is now in the federal district court, Northern Texas District. It's the case brought by 20 Republican attorney generals who are trying to use the repeal of the individual mandate penalty as a legal hook to invalidate the pre-existing condition protections in the law. Oral arguments were completed in September. The court decided to wait for the end of open enrollment to actually issue their ruling so that it didn't come in the middle of open enrollment and create any kind of chaos or disruption of that process. Open enrollment, of course, closes in a few days. We may have a dramatic turn of events vis-a-vis the ACA before this month is over based upon that case being resolved. Ultimately, Texas versus Azar will likely go to the Supreme Court, likely, and Justice Roberts will be the key, as he was in the Sebelius Supreme Court decision several years ago, which validated the ACA as constitutional. Interesting insight about Justice Roberts occurred earlier this week in the context of two cases involving Planned Parenthood. On Monday, the Supreme Court refused to hear two lower court opinions that said that Kansas and Louisiana violated federal law when they terminated Medicaid contracts with Planned Parenthood. The argument here was that while the case was obviously about abortion, that was the subtext for the litigation for the case, these states decided to terminate Planned Parenthood for no particular reason related to their qualifications to be Medicaid providers. It was unrelated to their competence and the quality of their care they provided. And what the court essentially said is you can't just arbitrarily, for other reasons, ideological reasons, take providers who are otherwise qualified and eliminate them. So the court said we're not taking up these lower court rulings which sided with Planned Parenthood, and Roberts and Kavanaugh were two of the votes that decided that issue. They sided with Ginsburg, Breyer, Sotomayor, and Kagan, and the speculation is that Roberts may have wanted to avoid pushing this fight into a contentious battle over health care at the Supreme Court level, and that may bode well should the Texas versus Azar decision reach his court, because the same dynamics may apply there. Another development this week involves the public comment period on the public charge issue closing. This is the issue that involves an effort by the federal government to use Medicaid engagement as a basis for barring an immigrant from receiving a green card. It would have, if it takes effect, the impact of discouraging the use of health care by immigrant families. Over 200,000 comments were filed, massive public response, including comments from Santa Clara County, and that's an issue we're following closely. One consequence of the November election that we had previously discussed is California's enhanced influence on health policy. Obviously, as Nancy Pelosi is still on track to being Speaker, we will have influence based on her tenure in that job. But we also have Congresswoman Anna Eshoo still on track to take on the chairmanship of the House Subcommittee on Health. That's the subcommittee that Henry Waxman chaired for many, many years. It's the subcommittee that has the primary policy role in the House for developing Medicaid policy, and Congresswoman Eshoo will have a major influence over the 2019 health care debate. Next year's agenda in the Congress on health care is still in development. There's still a lot that has to be figured out here, but Democratic House staffers have begun talking about their priorities for the coming year, and top of the list for them has been lowering the price of prescription drugs. That may be, for House Democrats, the #1 affirmative health policy issue in 2019. There's obviously strong bipartisan interest in, at least at the rhetorical level, in doing something about prescription drug prices. The meeting in the Oval Office yesterday between the president and the two Democratic leaders suggests that moving from kind of conceptual agreement to getting a true bipartisan consensus on anything will be very challenging next year. But again, prescription drugs at the top of the list. There's also interest in attempting to stabilize the ACA, especially given its enrollment drop, through legislative fixes. They will be very hard to get through the Senate, and they'll be hard to get through a standalone bill. So if they occur at all, they'll occur as part of a bundling within a larger must-pass legislative package. And it's possible that there'll be some progress on that front. Hard to know, but that's another priority for House Democrats. And then the one priority that we know they can deliver on without question is aggressive oversight. There'll be oversight hearings on the administration's implementation of health in a wide range of areas. We had the recent rule involving short-term health policies being expanded. Again, in the current Congress, that goes unexamined by the House. In the new Congress, changes like that will be examined in terms of what's the impact, what's the rationale, why are we doing this, the reduction in the number of navigators, the reduction in the ACA enrollment period, all those kinds of changes will be subject to House oversight in the coming year. So they'll be very aggressive in that realm. I'd like to close by joining with everyone else here today in saying a word or two to express my appreciation, Supervisor Yeager, to you for your leadership on health on behalf of the Santa Clara County healthcare delivery system. As Renee suggested, you've chaired this committee during some of the most challenging times in the history of the system. We had implementation of the ACA, which was challenging enough, and then we had this deadly threat to repeal it, which had to be fended off, and in the midst of that, work still had to be conducted to make the ACA as strong a program as possible. And you've led that effort on behalf of the county by chairing this committee, and you've done an extraordinary job. I've worked with many other elected officials in the world of healthcare at the county level, the state level, the federal level, in many capacities over many decades, and I've rarely encountered anyone more committed to the underserved than you, Supervisor Yeager. It's been a great pleasure to work with you, a great privilege to work with you for the past few years. You've done an outstanding job in overseeing this historic process of ACA implementation, and I wish you the very best in the next phase of your career. Thank you.
Thank you, Bert. Thank you. All right, we'll move on to item D, which is to receive report from Behavioral Health Services Department relating to organizational activities. Tony, I know we have a couple speakers. I don't know if you want to cover some.
Why don't we have the
speakers first, and then we can.
Any responses will be both Paula Renz and me. So why don't we have our staff?
All right, we'll do it that way. Natalie, again, it's Logan, I believe, Jackie Lopez, Scott Largent, and Abraham Hughes.
Hi.
Good morning.
Good morning, and hello to everybody. My name is Jackie Lopez, and I am one of the 2 designated Spanish-speaking community workers located at East Valley Behavioral Health. We offer in-person interpretation services to our patients. This allows patients to feel more comfortable sharing deeply personal issues in their psychiatric appointments and allows for more accurate diagnosis. East Valley also has bilingual mental health peer support, which has been vital to the clinic. With the current proposed reorganization of primary care behavioral health, losing these staff members from the clinics would eliminate this in-person service and would disproportionately impact immigrant communities. I'm concerned with the impact on linguistic and cultural capacity of the clinic. This is something that the clinic has prided itself since it's been there in 1972 in serving the community. And this is something that was deeply ingrained to me from the first day I arrived at East Valley Clinic 12 years ago almost. So for me, I'm here advocating for the community, for the clients, for the underserved there in our area, and I want to know what is the plan to ensure and address the cultural competency for these monolingual Spanish-speaking clients that we are serving. Thank you.
Thank you. Good morning.
Good morning. My name is Natalie Rangel. I am a mental health peer support worker at East Valley Behavioral Health. And basically my job duties there are to provide one-on-one support and group support to clients. Just a basic gist of it, you know, peer support work is an evidence-based practice. We complement the psychiatrists, the therapists, and the rehab counselors' work and increase the effectiveness of mental health services. We help clients stay engaged in treatment, which is really important, reduce expensive inpatient service use, also really important, and help clients increase their abilities to manage symptoms. I'm here to pose another question for everyone's consideration regarding, again, the issue of integration of primary care and behavioral health. My question is, how many staff members would be added to PCBH sites to replace the support given to mild to moderate clients from the existing staff already? Thank you.
Thank you.
Hi, good morning. My name is Abe Hughes. I'm an RC at Sunnyvale. I'm here to speak on my concerns about the restructuring of PCBH and how it will affect our clients with moderate to severe mental illness. Just one question to pose. What is the rationale to immediately move the support staff, such as HSRs and community workers, from the PCBH? Thank you.
Thank you. Morning.
Hi, good morning. My name is Logan Paulo. I'm a RC, rehab counselor at East Valley Behavioral Health. And, with the current reorganization and between the county and the union, we kind of haven't been able to figure this issue out. So we wanted to pose some questions to the committee this morning to consider before moving forward with the reorganization. And two of the questions that we'd like to pose are, what are the classifications of the new staff, and are they going to perform the same function as the existing support staff does? Currently, rehab counselors have the ability to go out into the field as necessary, which is something that with the current reorganization that we have been proposed, that support staff would not be able to do. Our psychiatrists are very worried about our clients because we're able to do the functions that we can. If that's replaced at some point, we're not sure what that might look like for our clients. The second question here is, what is the plan to ensure clients who are considered mild to moderate that they receive the same care they need in order to maintain their functioning and don't experience gaps in service? A lot of the clients that we serve are considered mild to moderate. They're not considered severely mentally ill. And, I can't tell you the amount of clients that I get that are considered more 6 and above, which is the way that we kind of view these clients in order to determine their level of services. And I'm constantly getting clients who have fallen on hard times, people who never thought that they would end up on Medi-Cal, who tell me that, the support that they've received from the staff have saved their lives. So please consider our clients' lives over financial or reorganizations before you make that decision, and try to work with us is all we're asking. Thank you.
Thank you. Scott?
Good morning, everyone. Scott Largent. I have mental health issues. I have ADD and ADHD, and growing up, I was in special education. I have a learning disability. And I also just process things differently. My brain fires, it just fires nonstop. I think about thousands of things at once. It's just how it works. When I got into martial arts, and I was in martial arts for a very, very long time, that kind of soothed my brain. It calmed me down, the exercise, a lot of things were very important for me. I should not be ashamed of having these types of problems. The roadblocks that I have ran into down here, I'm just shocked that they want me to fight for myself. I'm surprised that I don't understand. And the people that are getting into your dragnet over there, Tony, want their property back. They want their property rights protected. Just because they come into that system and they choose to say, hey, I want treatment, or hey, I want to use your sobering station, no one's protecting their property rights. And these people, they need to be protected more. They just really need to. And right now, when I went in front of Judge Helen Williams, and this is all over protesting, it's all over fighting for my property over there, okay, that was taken from me. I asked for ADA accommodations. I explained my mental health disorders. And this woman, Judge Helen Williams, was a bully and literally took my bullhorn and shoved it up my butt in court. Why did I have to go in there by myself? Why was I not protected? And why was this county not doing anything to protect my rights? I am fighting for my stuff myself. None of you are helping. How is that okay? In the homeless community and the mental health community, I just think you're just making money off of them. You put them through our jails now, put them on the ability to pay program, and you just start getting rich off these poor people, and these programs aren't working. I'm on a street level, and I know what's going on with my community.
And then maybe, Tony, as you answer some of the questions that some of the speakers mentioned, if you could talk about the proposed redesign of the primary care behavioral health. I'm trying to understand what the proposed changes are, what the rationale for those changes is, and what staff will be moved and when.
So I want to start, and I know that Paul, I'm assuming that your mic is on as well. I want to start, we've met with the rehab counselors. The rehab counselors are not being moved. Nobody is being moved on the clinical side. The rehab counselors as part of this initial integration, because the conversation that we're having is who are all the clients that are being served in primary care behavioral health. We know from the most recent look at data there are individuals that really need to be on the specialty side because they have very, very high needs. Our intent is to look at what the clients need and then figure out, do they need to, can they remain in primary care behavioral health, or do they need a specialty level of care? And quite candidly, we haven't reviewed all of that information, and we've asked the rehab counselors to continue to providing care as is. So I just think it's very important to say that that's been the conversation. What has been raised, and we've heard here in the board chambers, but also with me in the labor management meeting, is we do have a peer support worker and a community worker who are very much embedded in that community, and we really want to rethink, should those individuals come back over to specialty, or should we keep them in those clinic areas? And I think in terms of staffing and some of the other questions, Paul, do you want to jump in a bit?
Sure. Thank you, Tony and Supervisor Yeager. First of all, I want to acknowledge the staff for coming forward and expressing their concerns. From a systems perspective, our goal is to actually not to reduce services and to focus on the client's needs. And what should be understood is that today we do not, from our perspective, have a comprehensive system, a coordinated system in providing services to the mild and moderate. We have essentially done patchwork at each of our clinics to ensure that we have the correct service model in place and the correct staffing in place. Our hope in getting concurrence from the staff is to move forward with a service model that will further expand and increase our capacity to provide services to the mild to moderate population within the primary care setting. Because we do have limited capacity. And others at this dais, including Bruce from Valley Health Plan, would probably further support the notion that within the community itself, the greater community, this is one of the deficits that we have, ensuring that we identify early on and provide the right intervention services early on within the primary care setting. So we, in fact, are looking to grow and expand and provide a comprehensive service within the primary care system to this population. That's our ultimate goal. The other thing that is part of this plan is to further expand our capacity with respect to the pediatric patient population. We have a psychiatrist in LCSW at Bascom. That model in itself is not sufficient given the number of patients that we have within our health system that are accessing our services in terms of that patient population. So our goal is to have a comprehensive, coordinated system of care for the mild to moderate. At the same time, Tony, as she has mentioned, is the process to further expand services for the SMI population. And this is a process. So our hope is to get concurrence so we can move forward with our proposal, not take any rash actions or steps that will compromise patient care. And so there's going to be a transition period for which we hope will allow for us to better understand what are the areas that we have to rethink and what are the areas that we have to work together on to ensure that we're providing the appropriate services for our patients. So that is our goal. But first of all, we have to make the first step in order to move forward with our structure and our proposal relative to the staffing model for that comprehensive coordinated system across our system. So I know this is, because the system has been in place for such a long period of time, staff clearly have connected with the community and the patients they serve. And I think for you, Supervisor Yeager, and this committee, we want to make sure that we're sensitive to that and hear them during this transition period. And that's our goal. But we have to make that first step and move forward with this proposal.
No, thank you, and I understand what you're saying. I think there are issues about the sequencing of which steps we take and when, making sure that there aren't gaps as we sort of go through that process and take the various steps. What I will propose is to ask for an off-agenda report and then to have this item be heard at the January Health and Hospital Committee meeting. Some of the items, and I think some of the speakers, and Tony and Paul, you answered or alluded to some of the answers to these questions, but let's look at the proposed changes to primary care behavioral health and the rationale, which staff will be moved, and the timing, as we talked about, of those events, how we're ensuring clients receiving care from the rehab counselors, community work, and peer support workers won't experience a gap in services, and what's the plan to ensure cultural competency needs of the clients, that they'll be continued to be addressed, which I know some of the speakers mentioned as well. So the committee will hear that in January, then we'll have that report beforehand. Okay, thank you. Tony, other things in your report that you wanted to mention?
Oh, yes, there are.
Okay.
First, I think we have a little special guest coming in. But I want to say personally, as the Behavioral Health Director, Ken, you were from day one supportive. You've been supportive of mental health and substance use since your time here. You've been an incredible leader and really focused on our integration. Terrific staff, always well prepared. And I don't have the same experience as Mr. Margolin, but I have to say I've been doing public affairs and healthcare for 35 years. And you are the strongest elected official, the most focused on implementation. Are we doing the right thing in a 35-year history? You could be the guy running the state of California healthcare system from where I sit, but you've been an extraordinary leader in our field. And from a very personal level, it's really been an honor to work with you, quite seriously.
Thank you.
But we have some other people here. Since you're a 0 to 5 lead, we tried to get Alex Trebek, who runs the Jeopardy show. He's not able to come today, but we have Fabian Castaneda, who's one of our children's managers, who's going to try really hard here to step in for a little game of Ken Yeager Jeopardy.
Oh, my.
Now, we're doing this because this is 0 to 5, so in our kids system, we're very playful. And Fabian is standing right here, and I think he's going to go up to the mic, and we're just getting our little Jeopardy.
You know, Tony, that any number of things could go wrong with this.
They could.
I just hope you're prepared.
It's guaranteed it won't, but we'll see. I'm hopeful. I trust my team. So here we have Fabian standing in for Jeopardy.
That's right, ladies and gentlemen. This is the new game of Jeopardy! I'm your host, Fabian Castaneda. Let's meet our contestants. Contestant number 1, we have Moreta Juarez. Contestant number 2, we have Sherry Terrell. And of course, last but not least, Contestant number 3, we have Jennifer Pham. Thank you for joining us today. Let's move on to the clue board. And the categories? Wonderful. The first category is initiatives. The second category is accomplishments. So, Moretta, since you've been the recurring champion for the last 10 weeks, please feel free to answer the first clue.
So initiatives for 100.
Initiatives for 100. In the 2013 State of the County Address, this president of the Board of Supervisors supported the Universal Developmental Screening Initiative. Moretta.
Who is Supervisor Ken Yeager?
You're absolutely correct. Sherry.
Fabian, I will take initiatives for 200.
Initiatives for 200. This county supervisor championed the Getting to Zero initiative. Jennifer.
Who is Supervisor Ken Yeager?
You're absolutely correct. Jennifer, next clue.
I will take accomplishments for 100, please.
Accomplishments for 100. This county supervisor developed the first county office of LGBTQ affairs in the nation. Sherry?
Who is Supervisor Ken Yeager?
You're absolutely correct. Okay, Moretta, you're up for the final clue here.
Okay, accomplishments for 200.
Accomplishments for 200. That's the Daily Double! Moretta, since you got the Daily Double, you're going to have to answer this clue. And this is the final clue here. This political figure has served in Santa Clara County since 1992 in various roles, with over 12 years of service as a county supervisor.
Who is Supervisor Ken Yeager?
You're absolutely correct! Now, it is time for Final Jeopardy! And the category is Board of Supervisors. And contestants, here's your final clue. This avid runner has participated in over 30 marathons and numerous triathlons. You have 30 seconds. Good luck. We're down to the final Jeopardy question here. All righty. So we'll start off with Moretta. Moretta, what is your answer?
Who is Supervisor Ken Yeager?
That is correct. What do you have, Sherry?
Who is Supervisor Ken Yeager?
That is also correct. Jennifer?
That's a tough one. Who is Supervisor Ken Yeager?
Yes, that is correct. And thank you for joining us for that episode of Jeopardy! We love Santa Clara County. Goodbye.
Ken, our team has a little gift for you here. It's children riding a bicycle from the Behavioral Health Department. So we'd really like you to come down here with the whole staff. We've got a bunch of our leadership here. So come on. We're going to do this.
going to keep adding items to our agenda. But I think we're done, Tony, with your report then?
Yes, we are.
And so we'll move on to item 4, which is to receive a verbal report from the health officer.
Well, I cannot top that Jeopardy. I know. So I think I'm in a challenging position in the lineup here, but I'll do my best to add to the Ken Yeager Love Fest. So I just wanted to say a couple words, and then there's a lot of folks from public health who wanted to speak with you directly.
They have to fill out cards.
They have to fill out cards. Okay.
Joking.
Okay.
Joking.
Whew. Process. So I, just adding to the Love Fest, I think that your leadership, Supervisor Yeager for Public Health has been transformative. It is really hard to imagine what public health would look like without your service on the board over the last 12 years. We can't imagine. We really can't imagine. And I think that one of the core challenges and the paradox of public health is that when we're really doing a fantastic job, and our job is prevention, what the public sees sometimes is nothing, because we prevented all the bad stuff from happening.
That's the idea.
Yeah. But we are so fortunate in our county that we've had not just a seasoned policy wonk and politician, and you as our elected official, that you have been able to make the work of public health visible and sometimes even a touch glamorous. So you've put wind in our sails that's propelled us forward over the last 12 years and sustained us and kept us going. And I have to say, I think that sometimes your ears must be burning, because every time I'm with health official colleagues from across the state and across the country, I catch myself bragging not just about our county, but about you in particular serving on our Board of Supervisors, because there isn't anybody else that has a Ken Yeager who has their back and who's moving policies forward. So I'm sure your ears burn quite a lot. I wanted to, before I ask folks from public health to come up, just to say, you may not remember, but you gave me a little piece of advice early on, which was to always look to hire people who are more talented than you are. And that if you share that advice, that pretty soon you grow a very strong organization. So I wanted to, one, say what a pleasure it has been to work with your staff. Over the last 5 years as I've served as health officer, they are phenomenal and fantastic, and really a pleasure to work with. And I also just want to say that advice has enabled the Public Health Department to grow and become more robust. And I'd like to ask the folks from Public Health to just, those who are here, to come up and share with Supervisor Yeager on behalf of our department. So thank you so very much. We are enormously grateful.
Thank you, Sarah.
Good morning, Supervisor Ken Yeager and the rest of the staff here. My name is Bev White Macklin, and I'm a program manager for the Public Health Department's Black Infant Health, Child Health and Disability Program, the Oral Health and Teen Parent support programs. And I also work under and collaborate with our Nurse Family Partnership Program, our Car Seat Program, and many others under maternal child health. I'm here this morning to recognize you, Supervisor Ken Yeager, for your continued support to protect programs serving at-risk pregnant and parenting African American women and their families. Specifically, the Black Infant Health Program here I'm representing today. Supervisor Yeager, you've worked many years with our county departments and with your fellow supervisors to provide support and advocate for our programs. The BIH program is quite unique in that it's the only program in the county that serves African American pregnant and parenting African American women and works to reduce their infant mortality rates in our county. On the behalf of the staff of the BIH program and the African American and Ethiopian communities especially asked me to thank you, and we'd like to express our appreciation for the leadership that you have provided and advocacy and support for our communities of color. And we wish you great success in all of your future endeavors, and Merry Christmas to you all.
Thank you.
Thank you.
Good morning.
Morning.
My name is Raj Gill, and I manage the prevention education team in the STD HIV public health program. During the past 10 years as a prevention education manager, my team has witnessed under your leadership, your committed leadership, of HIV prevention, a program nurtured to grow exponentially and very progressively. Public health now more than ever has a strong foundation to lead this county in HIV prevention with a well-supported PrEP navigation program, an innovative public health detailing program, a more vigorous strategy around community awareness and outreach under the Getting to Zero initiative that not only focuses on zero new HIV infections, zero deaths, zero stigma, but on sustainability, community partnerships, and evaluation. Our team really thanks you, Supervisor Yeager, for your strong advocacy and for your resources in better reaching our focused populations. I'm under no illusion that we're anywhere close to our goals. I'm just grateful that the Lenzen Health Center has 5 coffee shops within walking distance. And for all this, we're really grateful, and through our work, we promise to continue the legacy you so compassionately leave behind. Happy birthday. I'm your Facebook friend, so I know that. And best of luck in all of your future endeavors. You really will be missed. Thank you.
Thank you.
Good morning. I'm part of the public health family. I'm Bonnie Broderick with the Chronic Disease and Injury Prevention team. And Supervisor Yeager, you have provided so much leadership, inspiration, and support to all of our staff and the larger community. You have worked tirelessly to create an inclusive environment that supports the health of the whole community while concurrently being a champion of the underserved, and we are always impressed with that. You have been an amazing advocate and partner in working to transform community, to promote health and well-being, and prevent chronic diseases. I wanted to just share a few examples that our team wanted me to take forward, some of the groundbreaking work that you have done that had an impact not just locally in our county, but really had that wider state and national impact. That's your style, and we appreciate that. It's been, like Sarah said, we get a lot of accolades in public health for the work that's been done in this county with your leadership and the leadership of the county. So 4 quick examples. As a result of your leadership, restaurants that serve kids' meals must make sure that those meals meet nutritional standards, and they do not include sugary drinks. This has inspired similar laws across the state and the nation. It's similar to the leadership that you provided on menu labeling. It took 10 years to get to ACA and become a national law, but it got there, so thank you. You have been a strong supporter of the Healthy Cities program, inspiring most all of our cities to adopt many of the health policies that you helped pass at the county. The cities are very supportive, and our program is being looked at by other counties around the state, such as San Diego, so we're very proud of that work. Under your leadership, the county continues to stay on the cutting edge in tobacco prevention and control. An example of work that was done in Santa Clara County that contributed to the state law is the ordinance of selling tobacco moving the age of selling tobacco from 18 to 21. That was passed in Santa Clara County and then contributed to the state. In addition, there's now announcements at the state and federal level to implement the flavored tobacco restrictions that you led the charge of here in Santa Clara County over 8 years ago. You and your team have also been a huge champion of diabetes prevention. Again, you saw the need. You understood that raising awareness of the epidemic is critical, and taking bold system-level actions to mitigate the negative effects of health and economic effects of the disease is important. So all of those we just really respect your leadership in. Your engaging, supportive, and thoughtful personality has inspired our staff and our community, and besides that, you've made it fun. You've done some incredibly fun activities with us over the years at many events, so thank you for that. We're so grateful that for all you have done. You have been a champion. We'll miss your wisdom, your innovation, leadership, and humor. All the best to you, and thank you.
Thank you, Bonnie.
Rodrigo Garcia, Prep Navigation Specialist for Public Health. First of all, happy birthday, Supervisor Yeager. Felicidades. The face of the HIV/AIDS epidemic in Santa Clara County has shifted from fear to hope thanks to your leadership. From writing an op-ed in the Mercury News calling out local officials on issues concerning HIV/AIDS, to speaking before the Board of Supervisors in 1986, proposing a strategy to begin providing AIDS services, and most recently advocating to implement Santa Clara County's Getting to Zero initiative to help end HIV. Supervisor Yeager, you have created a legacy of vision and action beyond the political agenda. Thanks to your active support, we have been able to expand access to pre-exposure prophylaxis for individuals at high risk for HIV. Only in the first year of implementation, over 300 individuals were able to start PrEP to lower the risk for HIV. We also were able to reach multiple providers and educate them on the benefits of PrEP for their patients through academic detailing. We've also have been able to increase access for screening and treatment of STDs. And recently, through our new campaign, Undetectable Equals Untransmittable, we strive to end HIV stigma in our communities. Supervisor Yeager, your work continues to be an inspiration for many of us. On behalf of the LGBTQ community, Public Health Department, the theater arts community, we thank you for bringing hope when hope was hard to find. Thank you.
Thank you all. Thank you, Supervisor Yeager. We'll just leave it there.
Well, does that conclude your report?
Yes, it does.
Thank you, everybody. Thanks. Let's see. We move on to item 6, receive semi-annual report from the Office of County Executive relating to the employee wellness.
Good morning, Supervisor Yeager and
morning.
Remainder of all of my colleagues and so forth. My name is Leslie Crowell, and I'm here to introduce our staff to talk about the semi-annual report on employee wellness. But first, I'd like to make my own observations about your career here, and I never thought I would compare anybody to Byron Scher, who I worked for in the early 80s, because he was single-handedly, doggedly determined about the environment. And I feel as though you're just the closest thing that's come to that. And I always said there wouldn't be another elected official like him who would stick to his values and do it both on the ground and at the policy level. And I just appreciate your commitment so much. And it's had such a great impact here. And I've enjoyed listening this morning to hear more than even my own personal observations. So thank you very much.
Thank you.
With that, I'd like to introduce Landy Lopez, there we go, and Teresa Chagoya and Crystal Hover to talk about the report. So I'll turn it over to Teresa.
Wonderful. Good morning, everyone. Again, I want to also send my thank you to you. We've heard some wonderful stories about all the commitment you have for the underserved, but also for, on our end, for the employees. I think that's the important part, work that we do, and what you have really dedicated your time with us to make sure that our employees are taken care of so that they can do the wonderful work that they do in the community. So thank you.
Thank you.
And a personal note from me really is for allowing me the professional growth in this position in employee wellness. You've taken it from years ago through your vision of invigorating our employee wellness department to allowing us to flourish and prosper into this, what is now a significant element and a foundation for us as county employees and a great place for us to work. So I want to thank you for that. Also for pushing through not only being a true leader, as many have said in our county, but also outside of our county. Many of what we are doing here in the county are being looked at by other counties throughout the state and otherwise, so that they can start to look towards building departments and programs like we do for our employees. And I also want to take an opportunity to thank your health policy aides over the years that I've worked with, Laura Jones, Yvonne Jimenez, Ambui, and of course, Alexis, who's here in the audience. So they've been a real pleasure to work with over the years and all the wonderful initiatives that we've worked on. So let's on to the business at hand. So thank you. So for us, this is our highlights for 2018. We have quite a bit of successes that we've had over the last year. I'm going to highlight 3 of the biggest ones that I feel like have made an impact and will continue to make an impact as you depart and your new successor comes in. The first one being the county organizational health and well-being policy. That is definitely one that will be forever ingrained in our Board of Supervisors manual, how we operate in the county. This, at your direction, we were able to develop this policy that needed to reinforce the holistic approach that we have in the alignment between organizational health and personal well-being, the employee well-being. It addresses the core understanding that a healthy workforce, a well workforce, needs to be healthy, productive, and engaged and resilient. So I think the policy in itself will help us accomplish that as we create future administrative guidelines that will really address what we're seeing in the workforce itself. Looking to see at the data that we have from our survey that's coming up, looking at keeping the pulse on what's happening with the employees, from our wellness champions, from our staff, and from the learning organization team. How we are able to develop those policies will build off the foundation that we have at this countywide organizational health and well-being policy. And again, this is another one that we've shared with our Northern and Southern California partners. I'm very excited to really work on this with them. The next accomplishment is our employee engagement and well-being survey. We have this year combined the survey under the learning organization, so it addresses both the well-being and the engagement, really as the goal to develop an understanding that the interconnectedness between the two. With Gallup helping us with administering the survey, we were able to achieve this 44% response rate, which really amounts to about 8,800 employees.
Much higher.
Yeah, it was really great. And one of the wonderful things about that is that when we asked them specifically a question about employee wellness and being seen in the last 12 months, we had 92%. 92% of them said that they had heard, and which is wonderful because it really speaks to the work and really the commitment that we have from all levels to employee wellness within the agencies. The survey itself had 3 different areas. The engagement part, which really is about employees and how involved they are in their work and their workplace. So there was 12 questions around that. There were a few questions specifically around well-being, and again, well-being on the holistic view, making sure that as we looked in the policy that this particular well-being component also addressed the holistic view of what we're seeing as well-being. And the last one is really around our employee wellness specific for our department or division. And those are the legacy questions that we've had over time, specifically the one you just saw, which was the 92%, which has increased every year since we started this survey in 2011, 2012. So it's been great. And it really has been able to help us start to drive home the interdependency between the two. The one area that we did also like to, another area that we'd like to highlight is the wellness champions. Oh, I'm sorry, one more thing about the employee engagement survey. What really helped us understand and drove home the point around the interdependency between engagement and well-being was this particular item that we saw. Those employees who were more aware of the wellness messaging that we were pushing out were 3 times more likely to be engaged as for those who aren't involved with wellness. So really kind of seeing that wellness is a core component to making sure our employees are staying engaged in our workforce. And part of that need is, and part of the reason for that is our wellness champions. The wellness champions, as you know, they have always been such a great group of employees who are advocates in their own workplace. This is showing us from this specific statistic is telling us those who can have a wellness champion are twice as likely to be engaged. So really kind of understanding that the peer-to-peer understanding, knowing that, you know, we can do some great work as our department, but those specific touch points and those personal anecdotes and the personal connections with employees in their workplace helps folks really feel more engaged in the workplace. So They've had some wonderful accomplishments advocating for additional classes. Social services now has a quiet room because of the work of their specific wellness champions. They're leaders during our campaigns. They help us increase our participation every year, and they really help us promote a lot of the services that we have so that we are able to provide those at each location. And we're actually excited because you'll be celebrating with us next year, so you'll have another opportunity for, next week. Next week. I know. So you'll be able to have, we'll have some wonderful, maybe not as much as Jeopardy.
I thought maybe you knew something that I didn't know, so.
No, next week we'll be there.
I'm looking forward to it.
And so moving forward for 2019, and again, in continuing with your vision for our department and for employee wellness, we're looking to expand the network, strengthen those departmental relationships, specifically with the data that we have now from the survey. Using that survey data to really drive those local initiatives where we're trying to make sure those departments are not only succeeding with our county-wide vision, but also with the ones that are going to be helping to develop within their specific agencies. Financial wellness is definitely an up-and-coming, and it has been. We're starting to work on including financial wellness resources because we know how much stress that causes people and how that plays over into the work that they do. And then the last one is really looking at how to really push home and communicate the interdependency that we talked about between well-being as an employee and how it affects the organizational and its health. So with that, we'll take any questions.
Well, thank you very much. And as you stated, this has been an area that I have focused on quite a bit over the last 10, 12 years, and was glad that we could sort of re-energize employee wellness because it is so important. And particularly, as one of the things that the survey found, 77% of employees are suffering with physical well-being, having good health and energy to get things done. And certainly for anyone's overall health, whether they're at the workplace during the day or in the evening, we want to try to improve it as much as we can. And yet that can be difficult. And I know that we've worked very hard in trying to find the right combination of things that will work, whether it's the physical activity outside or the gym or the classes or the walks or the runs, attending all the events, just getting more education out there. But we know we still have a ways to continue to go. I know that when people are feeling better, they're going to do a better job at work. It's going to help our overall bottom line when it comes to health care costs and trying to keep those somewhat capped instead of always increasing as we've seen. So I'm really glad that we've, again, devoted as much time and resources, but I still feel that we need to put more time and resources. That it's that important in trying to get that message to our employees that it's to their benefit to take the stairs. It isn't the organization's benefit, it's their own personal benefit to be more active, and why we work so much on health. And I mean, there's so many things I could mention. Just the fact that we've been able to keep the cafeteria open, and so that there's good food to eat rather than bringing things that aren't healthy to snack on. All those type of things that we do to try to make it just a better workplace for people, not only psychologically and emotionally, but also physically as well. So I've appreciated your help along the way, and look forward to hearing about the progress that's being made. And thanks for mentioning Alexis and the staff, and I'll mention staff a little later on in a moment, but appreciate all the help that people have been able to give you as well. And I look forward to seeing you next week then.
Thank you.
Thank you.
Very much.
All right, we move on then to item number 7, which is receive report from the Valley Health Plan relating to activities, opportunities, and progress.
Good morning, Supervisor Yeager.
Good morning.
This month's report is fairly routine and stable, which is good. I will say a few things by way of real-time update on Covered California enrollment. Despite the headwinds that we've heard about in federal policy circles.
Those headwinds, they're still there.
Yeah, they're still there. Our interim results show that they haven't pushed us backward, at least. We are moving forward with slight growth so far. The enrollment results, as you can imagine, are lagged a little bit through Covered California, and we're now heading into the final week. So we are optimistic that what typically happens is a push of last-minute shoppers at the very end that will take us to at least a few thousand members growth, as opposed to what we've seen so far, which is a few hundred members.
Just to interrupt you for a second, is the state doing the same level of sort of outreach and communication as they had done in the past?
They have actually increased their spend and accelerated their efforts. As we heard about earlier, it's really the federally operated state exchanges that are bearing the brunt of federal policy a little bit more severely than we are. We're a little bit insulated due to the efforts of Covered California.
Right.
But of course, the mandate is a factor.
Right.
So fairly good news on that, and again, we're optimistic about last-minute results. So that said, in the spirit of the day, on behalf of the entire team at Valley Health Plan, you are going to be greatly missed by us. You've been such a strong supporter of Valley Health Plan in many ways, and at the same time, your office has been very collegial, very constructive, and yet very persistent in reminding us of what our priorities really need to be. I mean, Brian Darrow, I'll call out, has been great to work with. We often get very bogged down in operational details and challenges, and we're reminded by you and your office that we're here in order to facilitate access to quality health care for our members, and all of that is very much appreciated. Thank you again, and with that I'll conclude my report and defer to any questions that the committee might have.
I'm good. Thank you, Bruce. Thanks. Then we move on to number 8, which I think, David, is our last item, if that's correct. We see report from the Santa Clara Valley Medical Center relating to operational, financial, quality, and safety updates.
Thank you, Supervisor. First of all, after hearing all these comments, I'm surprised that Dr. Cody didn't make you an honorary public health officer.
Yeah, that's what I need.
Just a few comments. First of all, Supervisor, and a lot of people may not appreciate the impact you've had on the healthcare delivery system. So just a few statistics, because I know you're very keen on numbers, but the Valley Medical Center operating budget has grown by over 100%, if not more, during your tenure. That's brought about, given your good work and leadership with the rest of the team here, close to a 60 to 70% decrease in our operating subsidy. And if you take a look at the percentage of that of the total operating budget, it's pretty significant. And all of that is a culmination of many complex issues that have confronted this system, some of which have been mentioned here today, such as the ACA. The impact has been that we estimate that anywhere to close to 30 to 35% increase in services to our community, if not more. And that is critically important to the health of the overall community, the viability of this community in Santa Clara County. And the one thing that I would say with respect to all of this work up into this point, and I'm sure Dr. Smith and Renee Santiago would agree, we would not be in a position today to be talking about the acquisition of 2 hospitals if the system wasn't stable enough to manage and move forward and further grow and develop our delivery system. So for that, with your support, we're very grateful. With that being said, I really do want to take time, and because we run such a complex and large system, there are a few people that I wanted to come up and just say a few words. The first is Celine Ho and her team from Valley Homeless Program. Dr. Newton is joining her just to say a few words about your commitment and service to the homeless population.
Good morning.
Good morning. Some of our staff were here this morning, but they had to go back to clinic, but they really wanted to be here to thank you. On behalf of the Valley Homeless Healthcare Program, we wanted to thank Supervisor Yeager for your steadfast support of VHHP. When Supervisor Yeager started your tenure here as a county supervisor, we were a very small program, about 20 FTEs. Today, under your leadership and your support, we've grown to over 75 staff members, and we are an internationally recognized program providing care.
Great job.
We've become an internationally recognized program providing comprehensive care to the most vulnerable population in Santa Clara County. Supervisor Yeager, without your commitment to advocacy on behalf of homeless individuals in Santa Clara County, we would not be able to reach as many homeless individuals as we have, with as many resources that we have, in as many locations as we have, without your support and commitment and your trust in us. So as a token of our appreciation, we wanted to present you with a VHHP jacket. We are going to make you an honorary member of VHHP with our family, and we look forward to seeing you at so many of our community events. We had a lot of staff who wanted to show their gratitude, and so we couldn't present it all, so we gave you some reading of all of our staff. Thank you so much, Supervisor Yeager.
So, Supervisor, as you can imagine, the doctors and the nurses at Valley Medical Center are, there you go, very appreciative of all the good work. But we did want to, and Dr. Sanjay Karani is coming up, and Jill Sproul from nursing, and they just want to express their gratitude. And of course, there was one monumental event that occurred, of course, which was Sobrato Pavilion. But I'll turn it over to the good doctor.
Thanks, Paul. Good morning, honorable board members and Supervisor Yeager. On behalf of the physicians and the Department of Medicine at Valley Medical Center, I want to thank you for your support of the hospital and the physicians. You know, many years ago when I was a medical student, and I stress many years ago, my dean, I recall my dean saying to me, if you can for just a year, train at a county hospital, because that's where the roots of medicine and public service lie. That was 20 years ago, and I think I can speak on behalf of the other physicians as well as myself who have been there for so many years. It's the unwavering support of the community we serve and the support we have received by the members of the Board of Supervisors such as yourself that has kept us there. I distinctly recall being in the depth of the Great Recession in 2008. People in the county were losing their jobs and even their homes. We were in the wake of losing a hospital in 2004, and the county was developing an inpatient bed deficiency. And the community was asked to vote on a bond measure to fund the construction of the new bed building, and it required a supermajority. And incredibly, despite the financial crisis, not only did the bond measure pass, but over 75% of the votes were yes. And for those of us who were at VMC, this was a watershed moment. And it exemplified the support of this diverse community and the commitment of people like yourself who have supported a strong safety net system at Santa Clara County, in Santa Clara County. And this is a story to this day that I pass on to the new doctors who come to VMC in awe of the beautiful new Sobrato building and our new downtown clinic, wondering how this all came about. And I would also like to thank you for the support of not only the infrastructure, but also the technology that is essential to providing efficient, value-based quality of care to our patients. The decision to bring cutting-edge electronic health records and Epic to our system was a bold decision, but one that allows us to practice modern, integrated care here in Silicon Valley.
It wasn't easy.
Yeah.
It was not easy.
And finally, we can build the infrastructure and run it with technology, but ultimately, it needs to be filled with staff. And so your commitment to medical education and allowing us to teach the privileged to care for the underprivileged has allowed us to recruit some of the most talented physicians to the medical staff. And even today, your tireless work continues to make sure that the safety net expands and remains strong and robust. So Supervisor Yeager, on behalf of the physicians of Santa Clara Valley Medical Center, a heartfelt thank you for your vision and commitment to providing the physicians with the tools and resources necessary to give world-class care to our patients today and for many generations ahead. Thank you very much.
Thank you very much.
Good morning, Supervisor Yeager. As the Chief Nursing Officer at Santa Clara Valley Medical Center, I want to a heartfelt thank you for all the nurses, not only at the hospital, but within the health and hospital system. Your support and leadership has been instrumental, and as Dr. Karani said, with the Sobrato Pavilion. And as I walk the halls, I ask nurses, how is it different from your before Sobrato and after Sobrato? And they say, the private rooms, it's peaceful, it's quiet. It really provides an excellent environment for patients to heal. And there's designated family space. So we really have a focus on being inclusive of family members. And this is true in rehab, in our ICUs, which hasn't always been the case, oncology, and our step-down units. So the staff are loving it. And I have to say, in 5 days will be our 1-year anniversary of moving in. I can't believe a year has gone by. I also want to thank you for actually the increased ICU capacity, which has been so vital. I think our hospital is a lot safer because now we have additional ICU capacity and we can timely place patients in the appropriate level of care. And as Dr. Karani mentioned, as a new nurse, I did most of my clinicals at VMC, and I think, serving the patient population that we do has not only made me a better person, but it made me a better nurse. And all of the nurses that work at VMC are so thankful of the ability and honor to serve our patient population and our community. So as you reflect back, and I'm sure you will, please know that you have made an impact on thousands and thousands of patients' lives and their family members. So you will be dearly missed, and a heartfelt thank you from the nursing staff.
Thank you.
So, Dr. Newton.
Good morning, everybody. My name is Dr. Jackie Newton, and I'm standing here today alongside my partners and other leaders from the Gender Health Center, including Maribel Martinez, the director of the LGBTQ Office of Affairs, Anthony Ross, the program manager of transgender services at the office, Alice Navimugler who led the HHS LGBTQ Hospital Committee and is leading Whole Person Care, and of course, members of the Gender Health Center. Several of them want to be here, and they also had to leave early for clinic, but we do have Erica Arana here, who's the new social worker from our Gender Health Center. On behalf of the entire GHC team and SCVMC, we would like to sincerely thank you for your incredible support of this clinic. We finally opened its doors 2 weeks ago, and the very first patient we saw, within about 2 hours of being seen, wrote us a review. And so this is what he said. I actually had doubts coming here after being with Kaiser and receiving their transgender care and primary care services. I must say that Santa Clara Valley Medical Center is by far the best. They just opened the Gender Health Center on the 3rd floor of the downtown clinic. Today was my very first day with Dr. Alex Jimenez. Hands down, he made me feel very comfortable and at ease, just knowing that he and his team are very welcoming. He definitely knows his stuff and was there to help me with all of my concerns as my primary care doctor. I feel blessed that he and his team opened this new gender clinic for us. So thank you, Supervisor Yeager, because we couldn't have done it without you. I want to also take the time to recognize the work that you've been doing for years before the idea of this clinic had even come along. The clinic is a product of an entire cultural shift that you've been cultivating throughout your time in office. When you became an elected official who is openly gay and committed to the LGBTQ community, you made it clear that we in the LGBTQ community exist and that our voices matter. When you raised the transgender pride flag over City Hall, you showed everyone that the transgender and gender diverse community exists and matters. When your office called for a health needs assessment of the LGBTQ community, that's when we learned about the unique healthcare needs and disparities in the community and why this community matters. And of course, when you created the LGBTQ Office of Affairs, this empowered the community to lead and make changes for themselves. It was the key partnership between Santa Clara Valley Med, the LGBTQ Office of Affairs, and the board that made the Gender Health Center possible. This clinic and all of the other trans advocacy work throughout VMC and HHS are part of a larger social movement toward achieving equity. The county is directly combating transphobia, racism, sexism, and other institutionalized and societal oppressions that have attempted to reject, marginalize, persecute, and erase the community. So thank you, Supervisor Yeager, for showing us that the transgender and gender diverse community matters and that they deserve access to high-quality health care as an essential human right. Thank you.
Thank you.
Then Benita McLaren, our Chief Operating Officer, has a few words to share.
So Supervisor Yeager, my pleasure to be here today, and I want to say thank you so much for your support of our Go Public campaign. It's been a huge success, as you know, and has helped educate the public about the fabulous work at Santa Clara Valley Medical Center. It's also increased the public's perception of what a public hospital is and can be. It's engendered pride amongst our internal staff, as well as our community, as well as our external stakeholders. As you know, you may or may not know, our Go Public campaign has not only won 23 national awards, including a Telly Award for our commercial, and it's also won numerous awards for our multicultural communications. You can take pride in being being a leader and supporter of this fabulous campaign and what it means for our community. Thank you so much, Supervisor Yeager, and I just personally want to say thank you for everything you've done throughout your tenure here. We have a little gift we'd like to give you, and it is original. It is our Go Public trademark, and we want to say thank you for your part in making sure that this is something that we can have in our county forever. Forever and ever.
Jeff, you'll have to move over. There's just too many.
Well, thank you, Supervisor. And the one word that I would share with you that I hear a lot about is the word inspire. You inspire a lot of people within the organization, not just within Valley Medical Center and the health and hospital, but in this county. You give something for people to believe in. You pick agendas and initiatives that have a huge impact on this community, and you follow through on them. So for that, we are very grateful for your wonderful work, and we wish you all the best.
Well, thank you. Thank you. Actually, if you all just keep on talking, then I don't have to say anything. Wow. Thank you. Thanks to everyone. To sort of recount the last 12 years, but certainly the last 10 being on this committee and the last 6 chairing it, you've all brought up so many really incredible initiatives that we've been a part of, and knowing where we started to where we are now really is just incredible. And I worry that if I mention a couple, then people that I should mention all of them, but in all of your reports, you've really brought back the memory of where we were when we started, and again, the accomplishments where we are now, and particularly, Paul, with what you just said about being prepared to now have O'Connor and St. Louis part of our system, and I certainly mentioned it to Jeff as well. I hadn't really ever thought about that. I knew how far we had come, how many people we've insured, how many people now that are insured come to our clinics and hospital, that we're not hemorrhaging at all like we used to, how our survey rates are, and reports about quality care is up. I mean, all those things, and everything in public health and behavioral health, and just you mentioning the integration. My goodness, that took a long time to achieve. And really, it just, it all starts with leadership at the top. And I take full credit for Dr. Smith. No, not for me. Full credit for hiring Dr. Smith, because at a time when our health and hospital system wasn't like it was today, we knew we needed someone who really understood the system. And we were just so fortunate that when Dr. Smith applied, I knew he was going to provide that leadership. And what a great team he's assembled. All of you on the dais, but everybody that's within the organization, all the people that are under you really has really made the difference. And it took a while to get to where we are, but it's all worked out. And I appreciate all the kind words. People have been very generous in their comments, and I'm very grateful for them. I don't know if I've really had an opportunity to think about my leadership style, but you've all given me about an hour and a half to think about it, so that's been good. And so maybe just to say a couple things. I think first and foremost, you've got to get the right people in place. And if someone isn't that right person, you either have to find another person who's going to do it, or go to somebody else who's going to take that initiative up and claim it. Because otherwise, you're just spinning your wheels, always getting frustrated of not getting what you want done. And who needs that? And so you just sort of go on to somewhere else and within the system to be able to accomplish it. And I think that certainly helps being able to do that. And I think I have, if I have any knack, it's trying to find the right people who have the understanding and the authority to make things happen. And sometimes you have to alter your overall plans or drop some because you just know it's not going to work and all your ideas can't be implemented. But when you find other people in the organization who believe it as well, you can have them sort of pick up the slack and do the work that they need so you can get it done. I also know that I've worked, if I've done anything, I've wanted to make this a positive place to work, that people enjoy coming here, and because I think everybody is well-intentioned, intelligent people, any number of places that they could go, but they've chosen here. And it's not an easy job. The whole system is not easy. It's not easy to get anything through. It's a big bureaucracy and growing. But you at least want it to be a place where people know that they can make an effort here. And I've tried as much as I can, maybe not always successfully, is to be a part of that very positive conversation that takes place, particularly when we're in public. And if there's time to criticize, you do it in your office, trying to work things out, trying to figure out how you're going to get to the solution that you need. Ask all those hard questions then, figure out where things are, and once you've been able to correct it, you bring it back into public. And I think that has helped sort of, enable all of us to be a team and not to be nervous around each other, and sort of know that we're going to sort of proceed, and there might be disagreement on how to get there, but not where we want to go. And again, I've been very fortunate to be able to do that. I also know that it does take, more work than people realize to actually implement some of the policies that I've wanted. And I could name any number of them, maybe one that wasn't really quite so controversial, but even the nutritional standards. I always felt that if I have some authority over meals that are being served, I want to make sure those are the best meals possible. And I know Laura Jones is somewhere out there in the atmosphere, but 2 years just to get everybody on agreement on those. And then now we've been able to have so many other organizations adopt those same standards, and so they don't have to do that work. And I think that's the other thing that we've tried to do, because we've had resources that a lot of cities and other jurisdictions don't have, and certainly with our county council and everybody in public health and the whole system, we've been able to make it easier for other people. And I've received any number of awards over the last month, but one that was very special happened on Friday with the Cities Association, where they gave me their Legislator of the Year award, and I was the very first supervisor they had ever given it to, because they had given it to state and federal legislators. And then they talked about the 50 health policies that cities have adopted from our Healthy Cities dashboard, and which was exactly how I wanted this to happen. You think you want it to happen, and 9 times out of 10 it doesn't. But it's always nice when it does. And so, again, particularly on civil rights issues and immigration issues, all those things that we're doing in the county council's office also then helps other cities and counties elsewhere to be able to adopt those policies. And I've just had great staff. You've all known Brian and all the other folks even before him, but he's just done an outstanding job, and Alexis as well. As I've said, and this is a little bit of the quote that you gave, Sarah, you hire people that are smarter than you are, you hire people who are nicer than you are, and lo and behold, everybody thinks you're smart and nice. And so that's worked for me. That's worked for me very well. But maybe I'll end it there. But thank you for everything. Thank you really for a great 12 years. I've accomplished more than I ever thought I would. When we're younger and want to change the world, and we aren't quite sure how to go about doing it, and then you have a meeting like this where everybody talks about all the things that we've done together. It's been very heartwarming, and I appreciate it very much. So thank you. And David, does that wrap it up? That's it. I won't be seeing you on, it just says adjourn to the next meeting, so we'll leave that to be determined. Thank you all very much. Meeting adjourned.